Okay, so this last bit, I have a couple of clinical cases, and it's funny. I never really bothered to write clinical cases for this lecture series because we always thought that the drugs were relatively simple, and since they're over the counter, um, it actually made things a little bit more complicated because there's so many options out there. Which would be the best drug? How would you counsel a patient? And so I kind of came up with a few scenarios as to what I thought were kind of the dead giveaways to kind of steer you towards one over-the-counter drug compared to the other. And this really came about from clinical pharmacy experience, where people would come to the pharmacy asking for which drug would be better, and theoretically they all work the same. They all have the same indication, but there are slight nuances to these drugs. So hopefully that'll come about with these clinical cases. Okay. So the first one here, we have a 46-year-old man who works long hours and drinks lots of coffee, and he also gets home late from work. Okay, so he complains to his doctor that he basically has the worst indigestion in the world because he eats dinner late at night. All right, so his favorite food is Taco Bell, and he uses, get this, he uses 3 packets of hot sauce for every taco, which is a lot. And he's up all night in agony because of the spicy food. Okay, so what would you tell the patient? Well, obviously the most, probably the easiest thing to do would be to not eat the 3 packets of spicy hot sauce on each taco, but he probably likes it. And if that's the worst thing he does, then he's probably okay with that. So he's probably not going to change his eating habits, and he's probably looking for something over the counter to alleviate his symptoms. All right. So theoretically, A, B, and C would work. Okay. I would shy away from tetracycline because there's really no indication that he has H. pylori. Okay. This is just spicy acidic food before he lays down, and we don't know. He might be overweight. He might have extra adipose tissue pushing down on his stomach contents, which might actually make things a little bit worse. But I don't think there's really any indication for tetracycline. There's no indication that he has H. pylori. So that leaves Tums, omeprazole, and cimetidine. And so I had chosen omeprazole, which is one of those PPIs or proton pump inhibitors, over cimetidine. Okay, and so the reason I did that was because cimetidine is known to have lots of drug-drug interactions. Okay, and then his problem is really with nighttime acid secretion. Okay, and so both Tums and cimetidine will work, but a lot of his problems really come from just excess acid. So Tums will probably have to take, I think it only lasts about 2 to 3 hours, so he'll be up several times throughout the night taking Tums. Cimetidine has drug-drug interactions. Omeprazole has the longest period of reduced stomach acidity, and so I wanted to kind of draw your attention to this diagram, which was earlier in the lecture series. So this is the amount of stomach acid, this bottom, this green line right here. This is the amount of stomach acid. Let's make it a little bit bigger. And so this is basically the total amount of stomach acid that you can see when a patient's on a proton pump inhibitor like omeprazole. All right, and this would be the acid fluctuations in blue that would happen when a patient's on an H2 blocker like cimetidine. Okay, and so cimetidine will probably reduce some of his symptoms. Omeprazole will be really the most potent. All right, and so that's kind of why I chose it. And of course, if you're thinking, he starts his day off with acidic food, and we don't really know what he eats for lunch, even if he eats lunch, and we know that his dinner is late. It just seems like the proton pump inhibitor will give the biggest kind of bang for your buck in terms of reducing stomach acid. Let's look at this case. Here's a 25-year-old medical student celebrating the end of the semester with a wine tasting excursion with her friends to Napa Valley, California. Ooh. Prior to the tasting, she stops at an Italian restaurant for a hearty bite to eat. Always a good idea. She orders a dish with lots of garlic, probably a bad idea, And 2 hours later, she has the worst heartburn, not to mention the worst breath ever. So which medication would you offer her to produce the most comfort and or alleviate her symptoms? Okay, so obviously there's no indication that there's an H. pylori infection. Her GI upset is really probably the amount of garlic that she had, and maybe even the amount of tomatoes in some of the Italian food. So I don't think tetracycline is warranted. Omeprazole and cimetidine would work, but remember, she's planning on going wine tasting. Okay, and so she's basically got an upset stomach because there's probably a lot of stomach acid being pumped in there. Tums seems to be the most kind of benign treatment strategy because it's going to neutralize her stomach acid, and it might even be a better alternative because there will be drug and alcohol or ethanol interactions with B and C. And so Tums is really just calcium carbonate and aluminum hydroxide. So we're assuming she's probably going to go drinking. I would shy away from drugs that are biologically biotransformed by the liver. So I would remove B and C from that equation. And Tums seems like a good fit. So that same 25-year-old medical student now finishes the wine tasting and goes home for the holidays. So you can probably all relate to this. Her mom and dad made all of her favorite foods. So now she suspects she's going to have heartburn after such a rich meal. Okay, so which medication would you offer her? This is kind of tricky. So now here you're looking at Tums would offer probably the fastest relief. She knows she's going to have a problem because obviously she comes home and she sees all this food cooking on the stove or in the oven. And so actually, I think for her, assuming she's not on any other medication, I think cimetidine would actually be a good pick. Omeprazole would be fine. However, it's administered as a prodrug. Okay, and so again, this is kind of where you make the division in terms of acute versus chronic. And so the male patient that we had talked about here, this is kind of a chronic problem. It's okay if we're going to wait a few days for this omeprazole to basically become high enough in his plasma concentration. With this patient, with this 25-year-old female medical student, she doesn't have time to wait for omeprazole to be biologically transformed and activated. Okay. Tetracycline, again, is not warranted. There's no indication of an H. pylori type of infection. The Tums would probably offer the fastest relief in terms of heartburn, but it wouldn't be for long periods of time. And so, if you think she's home for a long weekend, if mom and dad are anything like my parents, I'm sure they're cooking for like 35 people, even though there's 4 people in the home. So, think maybe leftovers. She's probably going to be eating this food on and off at least for a day or two. So, sorry. So it seems like cimetidine would actually be a good pick for this particular patient. Okay, so these are just kind of different ways of looking at some of these different drugs that are out there, and this information is not really conveyed that well on the packet or on the dosing packet for these patients that are buying these drugs over the counter. So this is the kind of stuff that we had to counsel patients in the pharmacy about. And as I do sometimes have heartburn as well. So these are the things that I've kind of thought about over the years too, in terms of when should these drugs be taken, which is the better drug for the specific instance where this heartburn is manifesting itself. Okay, so hopefully you found this helpful, and here's the references, and then there were a few more that were used here as well. And please email if you have any questions. Thank you.